You got pregnant several times and you have the feeling that in spite of doing regular exercises and a diet, still you can't have a flat stomach. This happens for many reasons. My name is Dr. Alawi and I am specialized in plastic surgery.
Plastic surgeon.
Lots of female patients who got pregnant several times come to our hospital and they have the feeling that the abdominal wall is unstable, in addition to having extra loose skin. This extra loose skin, in addition to flatulence, are some of the problems that can't be corrected through exercises or a good diet. There are certain anatomical reasons for that, as due to pregnancy, abdominal straight muscles expand in the middle area. These muscles are responsible for the 6 packs in the abdomen, and this leads to weakening the abdominal wall. Lots of female patients don't know that doing exercises and a diet don't help to restore abdomen shape after pregnancy. Plastic surgery can help in this situation through abdominoplasty in addition to tucking the straight abdomen muscles. This is very important as it means to bring the abdominal wall muscles closer. Correcting the weak abdominal wall and dealing with extra loose skin is really possible through abdominoplasty or a tummy tuck and reinforcing the straight abdominal muscles. This operation has many types which we can choose from. For example, when we need to perform a full abdominoplasty or full tummy tuck, then reaching straight abdominal muscles and abdominal wall muscles is possible too. These muscles, in addition to other muscles, are responsible for the stability and stillness of abdominal wall, which means when we have an abdominoplasty and we want a full tucking, then we can evaluate and prejudge whether tucking and bringing closer the straight abdominal wall muscles is necessary or not in order to correct the abdomen shape. When operating an abdominoplasty, we can use many techniques. For example, when abdominoplasty is enough vertically, then we usually take a horizontal section, and this section includes the bikini area, so that the post-operation scars will be invisible or unseen. In this case, the location of belly button is changed and the external scars will be barely seen after 6 to 9 months. If we have extra loose skin on the abdomen sides, then vertical abdominoplasty is useless or unhelpful. Thus, we do a letter T-shaped abdominoplasty. This means another scar is formed in the middle of the abdominal wall in order to fix the loose skin on the side. Abdominoplasty is a complex operation and is associated also with some complications which might occur. For example, fluid retention, edema, or seroma, plus bleeding during and after the surgery. Many patients ask about the possibility of having multiple procedures and perform them in one operation. In principle, multiple plastic surgery operations is possible, and this is used regularly, but in specific conditions for such operations, like patients being healthy and have no major previous diseases. Here, we have to think that such operations take longer time to be performed, thus, other complications might occur. For example, usually we can group thigh lift and arm lift operations. We of course decrease the anesthesia procedure through having multiple surgical procedures, but we must not forget that having these multiple interventions is also associated with a significant restriction in movement, and the wound areas will of course be larger. In some multiple procedures operations, especially when grouping horizontal thigh lift, in which not many cells are moved or exposed to air, then we can group this procedure with arm lift procedure, for example. This is possible. But we always have to think of the risks before operating such multiple operations, such as blood clots. The most important thing in any surgery is patient's health and to be safe. Then to evaluate in detail whether having multiple procedures operations might increase the risk before the surgery. Other multiple operations are like liposuction in the thigh area with arm lift in the humerus area. Another example is liposuction in the waist, thigh with abdominoplasty. All those multiple procedures operations are possible, and we can, for example, use the sucked or extracted fat from other areas in breast enlargement surgery. Through the multiple procedures operations, patient's time is saved as cell recovery happens once and not twice, in addition to recovery period which ends in 2 to 4 weeks. Strict and frequent monitoring is essential so that any awkward complications are detected and treated early. Patient safety in these cases is the most important theme. The pre-evaluation for each case is important too. My name is Dr. Alawi. See you in next video.